Okay, so apparently we're gonna have to split this up into several videos because my phone sucks. Also, I just watched the old video and I apologize. I say quite a bit. I'm sorry, I'm not a public speaker. I've only done it twice. I'm gonna try to be much better about that. So let's continue on, shall we? Treadmills. You guys have probably all tried a treadmill before. You probably haven't used it in this capacity, or maybe you have. Normally you think treadmill, you think cardio, but do you think posterior chain muscle activity? Probably not. So you can use your hamstrings, your glutes, work that whole back chain of muscles. You wanna work the quads? There you go, working the quads. All right, what else do we have? We have a scale. So you probably think, get on a scale, see how much you weigh, you're done. Maybe get your BMI. There's actually other functions we can use the scale for. Let's say someone comes in post-surgically for a knee or a hip or whatever, anything lower extremity. And the protocol from the surgeon says weight bearing is tolerated. So you want to see where they are on that particular day. So you say, put your affected leg on there and push down until as far as you can comfortably. Let's say they go and they push, give it a second, they're pushing, and they can only get 55. That's as far as they can go before it gets uncomfortable. Okay, let's come over here to our lovely leg press. 55 pounds comfortably. All right, let's go. Let's be conservative. 30 plus 15, 45. Try that out. There you go. We're not just going in blind. We're going in cautiously, and we're being methodical about our patient's care and how we move forward. Speaking of that, let's move forward. Okay, we got a strap over here. Speaking of legs, let's say someone has tight hamstrings. I don't know if I can do this holding a camera. Here's a stretch that you probably all tried at some point. Oh man, this is tougher than it looks. All right, come in, they have tight hamstrings, so you wanna go ahead, stretch out those hamstrings. You think, okay, maybe do that, maybe do some heat, maybe do some massage, and see what we can see. Actually, not always the case. Oftentimes when people have tightness in their hamstrings, it's due to the fact that they have weakness in their core. So what we want to do is, of course we want to stretch it and do all that good stuff I mentioned earlier, but you want to strengthen the core. The stronger the core gets, the more the body will relax and stop sending neurological signals to the hamstrings to tighten up to compensate for weakness. Here's an example. Here's our hip deck. Now the hip muscles are actually part of the core. The core is not just the abs, it's not just the six-pack muscle. It includes all the muscles underneath the abs, like the obliques and the transverse abdominis, and your side hip muscles and your back hip muscles, and even your low back muscles. So come here, work the hips a little bit, work a variety of other muscles, and then include that with some stretching, and you're gonna get looser hamstrings. You're gonna feel better. What do we have over here? Okay. Let's say someone has some balance issues. So we have this beautiful climbing wall over here, which we don't actually use for climbing. So since we don't use it for that, we could have someone, let's say, stand on this foam, which is unstable, and then take their base of support, and we'll weaken it by bringing it together, and then have them reach across their body to challenge their balance. Let's say someone has some shoulder issues, difficulty with active range of motion. Take a seat, stand up, reach up as high as you can go. Get up there, tiptoes. So we can use even a climbing wall that we don't use, we can still use. You give us anything, we're gonna find a way to help someone with it. Speaking of balance, here's a balance board. Sorry, I did it again. Here's our balance board. You can get up on there, start with some rocking, do some balancing. That's too easy, let's grab a ball. All right, let's see if I can do it. Well, apparently not. Usually we do it with two hands. Challenge your balance by getting up on there, multitasking, maybe giving them a weighted ball. All right, what do we have over here? We have a stool. All right, that's just for PTs to sit down and use when they're doing hands-on stuff. Actually, not the case. Let's say someone has some weakness in their hamstrings. Let's have a race. If that's too hard, you can do both at the same time. Let's say it's just way too easy. You can do one at a time. Let's say they want to work their quads. Turn around and do that. So even a stool can be used for physical therapy. We get the Bosu ball over here. All right, let's say I've got some weakness in my ankles. We've been working on it. We've been doing some banded exercises. Let's say we tried the balance board. We're